Good afternoon and welcome to From Numbers to Knowledge, introducing the TBI Dashboard webinar. Please make sure you're using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call. Questions can be submitted anytime during the presentation using the Q&A feature located on our control panel. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Stillman Bridges and Mary Beth Brown. For closed captioning options, select the closed caption feature located on your dashboard. To adjust your video layout and screen view, select the View feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics includes introductions and an overview of the TBI dashboard, along with a live demonstration of how it can be utilized. At this time, I would like to turn it over to Scott Performance, TBI Team Lead for the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you so much. And I would also like to introduce Ginger Yarborough. She's our Chief Clinical Officer for the IDD, TBI, and Olmsted section of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Hey, everybody. Thanks. Oh, sorry, Scott. I wasn't trying to step on toes. Hey, like Scott said, my name is Ginger Yarborough. I have been in the field for about 26 years, starting off as a DSP and working at providers, working in our managed care organization locally, and came to the state about right at 3 years ago and have the pleasure of working with Scott and our TBI team.
Thank you, Ginger. Next slide, please. So this is our agenda for today. As you can see, we're going to review why we needed a dashboard, how the dashboard was created. We will be providing you with a live demonstration on how you can utilize the dashboard and what we are currently using it for and what we plan to use it for, since it's so new for all of us. And then also, of course, how you can use the dashboard in your various roles as advocate, provider, and so forth. Could we move to the next slide, please? Okay, so why did we create the dashboard? Well, we recognized that while we were delivering services, we didn't really have a publicly accessible way to clearly show who was being served, what services they were receiving, and how often. There was also a specific request from the State Consumer and Family Advisory Council that emphasized the need for greater transparency. That request added urgency and direction to this work. Next slide, please. So before this dashboard, much of the data existed internally within the division and department, but was not centralized or publicly available. And so that made it difficult for advocates to support funding requests with data, and it made it challenging for policymakers to be able to compare prevalence with actual service investment. Internally, we also needed clearer metrics to guide planning. Next slide, please. So this is the first time this level of Medicaid and state appropriation service utilization data has been made publicly available in North Carolina for TBI. It's not just a data dump, it's structured for accessibility and designed for multiple audiences, from advocates to policymakers to managed care organizations. Next slide, please. So several groups, of course, as you can see here, will be using it. Our Brain Injury Advisory Council, the Brain Injury Association of North Carolina. They will be using it to inform advocacy efforts. Internally, our teams will use it to guide strategic planning and track outcomes, as well as, of course, being held accountable by the community. So we should see the uptake of services increase over time as our action plan is implemented if what we were doing is successful. And so you can see here all the different groups that will predominantly be using it, but I'm sure there will be many others. So if we could go to the next slide, please. So what it took to build, and so that required a significant collaboration because both Medicaid and the Division of Mental Health, Developmental Disabilities, and Substance Use Services operate under the North Carolina Department of Health and Human Services. We did have existing relationships that helped. However, each division has its own governance and approval processes, which required negotiation and coordination. And so over the past approximately year and a half or so, we've really spent a great deal of time working on drafting this dashboard, getting continued feedback from stakeholders throughout that time, and then, of course, negotiating different portions of the dashboard and making sure that it would be readable and user-friendly for everybody that would want to access it. So if we could move to the next slide, please, and I am going to hand this off to Ginger, who will take us through on how to use this dashboard. Thank you.
All right, and I am going to steal screen share. Y'all be patient with me for a second. I'm used to Teams, so. Okay. Scott, can you tell me that if you can see my screen?
I sure can.
All right. So I'm really excited to share the TBI dashboard. I know when I first came here 3 years ago, trying to find data and trying to get the information was really, really challenging. And this just puts it all in one place. It's not the end all be all. It's going to be a work in progress, but finally we have a source of truth to start with. So I'm going to start with the summary page. The summary page is inclusive of all of the other tabs together. So you can see we're starting with fiscal year 2024, and the fiscal year for 2024 runs from July of 2023 through June of 2024. The fiscal year 25 data is coming very, very soon. We just didn't quite have it ready before go live, and we really wanted to get this information out to folks. You can also filter by plan. So as you can see here, we have all of our standard plans as well as our tailored plans. You'll see East Point and Sandhills here because they were still active during that fiscal year of 24. But you can click on any of these and it will update the numbers to show based on that plan, which I think is really helpful when you're starting to talk about comparing plans and prevalence, especially across geography, when you start talking about the different tailored plans. You'll see 16,700 individuals with TBI have Medicaid in fiscal year 24. And then you'll see across the different programs, the number of people that are accessing these services. Again, please note these are from 24. So we're going to have updated numbers, and some of these numbers are really low. For example, 1915I had just launched. TBI waiver, that was almost 2 years ago at this point. So the numbers have definitely changed since then. If you scroll down, you can start to see all of the different age groups, ethnicity, gender, and race, all broken down. And you'll see on each of these tabs, the breakdown as well. So we'll start with NC Medicaid Direct. So here you're going to see those numbers change. So there were much fewer individuals on Medicaid Direct. Here you see these less than 11. So in order to protect privacy, anytime there is a number that's under 11, we're just going to say less than 11. This is in line with our own privacy rules, but also with our Centers for Medicaid and Medicare Services for their privacy protections as well. Prepaid health plans. So prepaid health plans, basically the tailored plans, but in fiscal year 2024, they weren't yet tailored plans. So here you can see 5,000 individuals with TBI were on the prepaid health plans during those years. You can see 1959, 56 people, and all of these numbers are pretty much the same as that main dashboard because of the way that these services break down and who's allowed to provide them. Here you can also go through and separate it by tailored plans or by prepaid health plan, I guess I should call them. So for example, I'll pull up Alliance. You'll see numbers all the way across. I do want to point out, if I were to pull up, let's say VIA, the numbers change and you will not see anything in the waiver because the waiver has not gone statewide yet. So you'll only see waiver data for Alliance at this time. Go back to include all plans. And again, all of this data updates when you start pulling it by the individual plans. When we hit fiscal year 25, you will only see Alliance, Partners, Trillium, and VIA. Okay. When you click on the tailored plan, again, those hadn't gone live yet. And so you'll get this message that just says, we're not live in 2024. So we will be doing, so once we hit the fiscal year 25, it will all update and you'll see it for the tailored plans. The standard plans, I find this one really interesting because when you look at the summary page, there's 16,700 individuals with TBI on Medicaid, and 11,000 of those are on a standard plan. And I'll explain later why I find that interesting and how it helps inform some of our work that we're doing. All right, and then finally, oh, and just like all the other ones, you can actually choose one of your standard plans and see how their numbers break down as well. So, and then you go back to all plans. And then finally, you have the DMHDD-SUS services. So these are your state funded services or services and supports funded through state appropriations. Again, you see the numbers across. We did not break it down by tailored plan, but you can see the different numbers statewide. Again, those numbers are so small, it's really hard to break it down by tailored plan without violating all of the privacy rules. You would just see basically a lot of under 11s with this data. We've also included definitions, and these definitions are pretty standard across our other dashboards and across our other areas. So if you have questions about what the different plans are or what data you're seeing, I would start here, but you can also always send us questions and we're happy to answer those questions. I want to go back to the summary really quickly. Oh, the other thing I wanted to point out is this goes back to 22. So you can actually go across 22, 23, and 24. So you can see the numbers across the years, and this will continue to grow. So now I am going to stop sharing and ask for the slideshow to be brought back up. And we're going to talk about how we're actually using this data and give an example. Okay, next slide. So if any of you, while that's coming up, if any of you are familiar with the quality improvement cycle, Plan, Do, Study, Act, you might hear it called PDSA cycle. We use that cycle a lot within the Inclusion Connects realm, within our strategic planning, and now within our state action planning for TBI. So we are firmly within the planning stage. Do we have the slides pulled up? Can we pull those up? We may be having some technical difficulties. Tell you what. Oh,
Sorry, we are having some technical difficulties. Give me one moment.
do you want me to share screen?
I think I got it. Give me one moment. I think we're good.
Okay. All right, sounds good. So again, here is the PDSA cycle, the Plan, Do, Study, Act. And we are currently in the process of looking at this data, understanding the data so that we can make some plans. What is it telling us? We're also in the middle of doing our state action plan, which is really exciting because that is being informed by this data as well. I'm going to give a real quick example of what that looks like. Next slide. So as we were going through the dashboard, I don't know if any of y'all noticed this like I did. One of the biggest things that popped out to me was this 58, the number of people with TBI accessing 1915I services. 58 seems super low. Now, granted, those services had just launched, but during that same time period, for the IDD population, there were over 10,000 people accessing 1915I. So this seems really lopsided because the prevalence isn't that different. They're both around 2% of the population. So you would expect to see very similar uptake of services. Now, earlier when I said about the standard plan having 11,000 individuals with TBI versus the 16,700 on Medicaid, that's where we're starting to see maybe some of this is because of that. So if you're on the standard plan, you don't necessarily have access to 1915I unless you transition. And you may not be informed about what 1915I or even that it exists. So I think there's a start of why we're seeing this lopsided services access. The other part of it is as we were doing our action planning committee, access to services was a huge part of the discussion. So the providers, care managers, managed care organizations, people with TBI, family caregivers, all noted some very similar access barriers. So understanding what the services are, knowing how to get to those services, and understanding that process for professionals and individuals with TBI. So we know we have some access barriers to address there within our action plan. So education, communication, and streamlining the process are all ways that we can start addressing those 1915I services. And if we're doing what we think those actions will do, then we would hopefully see the number of people accessing 1915I services increase over time. Next slide. So like I said, we're in our state action planning process right now. We started back in October. And we had 3 work groups over October through December. And then we are working on our draft plan right now. And if all goes according to my plan, it will be out early next week for public comment. And I really encourage you to keep an eye out, give us the public comments, like give us all of your insights because we can't write a plan for the state without everyone in the state helping us do that. So be on the lookout for a hot topic coming. And then we will finalize it and publish it officially to implement July 1st, 2026. And then over time, we're going to implement that PDSA cycle, and we're going to keep an eye on these numbers, part of the dashboard, to see, are those numbers going up? Are we seeing any type of impact from the actions that we're implementing? And if not, then how do we tweak our plan? How do we tweak what we're doing so that we can increase access to those services? So that's just one example of how we're going to be using this dashboard. But like Scott said, the public can definitely use the dashboard, informing legislators, informing the public, informing everyone about the actual numbers and the needs, and being able to share that confidently is a huge plus when we start talking about what we need as a community to support individuals with TBI. All right, so next slide, please. All right, so what's next for the dashboard? As I said earlier, this dashboard is a little bit of a work in progress. One thing that we're going to be adding is maps. So we have maps coming, so you can start to see the services and where they're concentrated and which areas are getting more access to services versus others. And that can help target where we have specific actions within our action planning. We're going to keep using the dashboard for our own metric tracking, and then monitor it for changing needs. And if we need to add more metrics to the dashboard, we can do that as well. We also want your feedback. So if you see that we're missing a key data point or demographic data point, please let us know, because we want this to be usable for you as the public as well. And then using it for policy informed investment decisions. So again, with that action plan, if we're seeing less access in our rural areas, that's where we need to pay a little more attention. So making sure that we are using this information to actually guide what we are doing. So to wrap it all up, next slide, the big takeaways. So at its core, the dashboard gives us data that we can transform into action. So the data gives transparency to what we're doing, who's getting access to services, and it helps you as the community hold us accountable for what we are doing to make sure what we're doing does what we think it's going to do. It also enables advocacy from the public side, which ultimately results in data-informed policy change. And with that, we will turn it over to the Q&A. Scott, you went through your slides super fast.
I know, I'm so sorry, but I actually just had a couple more quick things to add, if that's okay.
Yeah.
One is the data will be updated, and I don't remember if you said this already or not, so apologize if you did. But the data will be updated in two different ways. So the Medicaid data will be updated every 6 months. And the state appropriations data will be uploaded every year. And the reason for that is because of, with the state funds portion, the billing and so forth that comes in has a significant lag period, anywhere from 60 to 90 days. And since there is a finite or a concentrated amount of funding available, we don't see those numbers drastically changing within a 6-month period of time. So that's why it was determined, at least for now, that we would be uploading that data particularly every year. So just be aware of that. And I also want to share that we have already started to share this dashboard with others. I'm super excited that we have this opportunity here in North Carolina. I do believe we are the only state in the country to have such a data dashboard for brain injury. And so again, have shared out the link with others in other states. I know folks are interested in how we pulled all of this together. And so we will be sharing that out as well. And just to emphasize something Ginger just said, this is the beginning, right? So this is our baseline dashboard. We fully anticipate changes to be made over time, needs change, focuses change, and so forth. So as you all are out there advocating and doing your work, within your stakeholder roles, if there are changing needs that you come across, please let us know so that we could certainly consider those potentially for updates to the dashboard moving forward. And I think that's it, unless we have, do we have Q&A? Any questions or even comments or feedback or reactions?
I don't see any open questions. Let's see. There was a question about when do we expect the 2025 data? And we're hoping May we will have it posted. Let's see. Can you explain how less than 11 is related to privacy if we aren't digging into recipient details on the dashboard? So the less than 11 logic is if you're looking at the dashboard and you've got all of those demographics, let's say you separate it by, we're only going to look at Alliance's catchment area, and I can piece together that there are 3 people, 0 to 2, with a traumatic brain injury in the Alliance catchment area that also meet this ethnicity and this gender. It gives the opportunity to actually identify a single person. And that's why there are these rules around the less than 11. It's so that you can't walk backwards and figure out exactly who's who. It would take a lot of work, but that's the logic behind it. Let's see.
So maybe just to share out, in case folks have missed it in the chat or in the Q&A box. So we do expect the 2025 data to become publicly available, or rather uploaded into the dashboard by May-ish timeframe, because that will give us sort of the cutoff, if you will, for the preceding fiscal year's data for the state appropriations program. And so we'll be able to have an opportunity to upload those numbers at that time. And then, of course, Medicaid will be able to do its upload as well. So just so how you have a better understanding of the inner workings of how that works, we collect, of course, all of our state appropriations data, and then that data is sent over to Division of Health Benefits, who then uploads it into the dashboard along with their Medicaid data specific to the TBI population.
There is a question I want to answer live that just came in. So to answer the question, how many people have TBIs in North Carolina, can we appropriately point to the total in the dashboard, or with what particular caveats? I think it's really important to note that those in the dashboard only capture those who have touched the public system. So 16,710 people, I think, was the number of individuals with Medicaid with a TBI in their record. But as you and I know, there are so many people that may never touch the public system or who go misdiagnosed. So there's still some of those caveats. If you go just based on prevalence data, I think, and Scott's going to correct me if I'm wrong, I think in North Carolina, the estimate is closer to 208,000. Is that right?
Yes. And I think it's going to be, this tool is going to be also helpful, as Ginger had said earlier, in seeing hopefully how the numbers of folks that are being able to engage with the system in terms of receiving services and so forth increases over time, with all of our initiatives through the state plan activity, through Beyonce's advocacy and outreach, and BIAC, and certainly other groups. I do see a question here in the chat too, about people access. I'm sorry, I just lost it now. Sorry, oh, so one commenter, I'm going to just elaborate a little bit, But if you look on the dashboard, when you start to look to review it, you will see a lot of descriptions in terms of what the data actually means. And so it's going to be really important on each dashboard page. It will describe specifically what this data is demonstrating, right? And so there was a question in the chat about TBI diagnosis. And does this include mild or concussions? That does not result in functional impairment. And so it does not. So again, just to reiterate, we know there are a lot of folks out there that have a TBI at various degrees that may or may not be included on this dashboard because they haven't hit the system yet. But in order to access services, at least for the Medicaid side anyway, you do need to meet the level of care in order to be able to qualify. So just be mindful of the different caveats and specifics. We spent a great deal of time trying to make sure that the wording was clear on each page. If you are unclear, please let us know. Submit your questions through our TBI contact@dhhs.nc.gov or reach out to myself or Ginger directly or Stephanie and let us know. You know, now that it's public facing and it's live, this is a really great opportunity to start doing those reviews in real time and making sure that we have presented this information in a meaningful way and that's clear for you and others to understand. And are happy to take any and all feedback.
I see one more question from Jean. How do we quantify veterans with TBI? And we are still working on that. It is a great question. Those are sometimes two systems that don't always talk to each other very well, and we are working on that collaboration. And there was one other question, but I'm not quite sure I understand. We offer advisory for state services, but how do we know numbers? I don't quite understand that question, if you want to reword it. Actually, that was the last question.
Mm-hmm.
Oh, as part of the veteran question. Gotcha. Okay. Thank you, Jean. Yeah. All right. Well, this was short and sweet. Oh, let's see. Is it possible to have data be released as a .csv format? I do not know. That would be a question for our quality management people, but we can take that back and find out if you want to email me so that I can get you a response. I will drop my email address into the chat right now. And as always, if there are questions around the dashboard, if there are questions around TBI services in general, you are always welcome to reach out to us. We're always happy to talk about TBI services and supports. You know, whoever wants to ask questions. Thank you, Scott. And there is the TBI contact email address down in the chat as well. And with that, we will go ahead and wrap up. I think I'm giving this back to LaToya.
Real quick, one last final thought from me, if you don't mind. Please be aware that we are going to be looking at this dashboard and sharing, you know, changes and updates to the state plan, which again is tied to this dashboard at regular Brain Injury Advisory Council meetings, State Consumer and Family Advisory Committee meetings, and other public forums. So please be on the lookout for that because we will be sharing any updates or potential changes that we're considering as we move forward. And of course, always wanting to make sure that we're getting your feedback on your perceptions of the dashboard.
It's all yours, Latoya.
Thank you, Ginger. If we did not get an opportunity to answer your question during the webinar, questions and feedback are welcome at bhidd.helpcenter@dhhs.nc.gov. The recording and presentation slides for today's event will be posted on our Community Engagement and Training webpage. The links are included in the chat box. There will be a brief survey following today's webinar, and we will appreciate your time completing it. This concludes our webinar for today. Thank you for attending.